program again. And as you all know, this is the 8th module of Young Ophthalmologist launch, and it is in collaboration with the Young Ophthalmologist Society of India. So far, they have done a wonderful job. Like they have taken topics which are out of the box, like editing, video editing, how to prepare for FRCS examination. And all these programs are like well appreciated, and there are a lot of messages separately for me that you should continue such programs in future also. So today they have come out with a very important topic, that is how to prepare for FAICO examination. FAICO examinations, as we all know, it's a venture by the All India Ophthalmic Society, and a lot of people are like appearing for that, and even now that application is called for. And one important thing is there are no guidelines as such how to prepare for the examination, even though they have a syllabus. So the best teachers are those who cleared this examination. So today we have taken the Retina specialty, and in this we have Dr. Anjana S. From Comptrust Eye Hospital, Calicut, who will be talking about the theory part, and Dr. Asha Purna from Chaitanya Eye Hospital, Kochi, who will be speaking about how to approach FAICO examination from practical point of view. And as we all know, Dr. Rakhi is there as moderator, and she has taken a tremendous effort to make this program happen. I appreciate Rakhi for her all these efforts. Congratulations, Rakhi. And we have Dr. Rahul R. Menon from Kochi, Dr. Indu J. Nair from Trivandrum, and Dr. Divya M. Nair from Calicut as in the panel. With these few words, I hand over the program to Dr. Rakhi. Over to you, Dr. Rakhi.
Thank you, sir. So a very good evening to everyone who has joined us today and has decided to spend your precious evening with us for this KSOS York webinar series. So firstly, before we start, I would like to thank Dr. Baston sir, our scientific committee chairman, and all the KSOS governing council members and executive members for their unwavering support with the Young Ophthalmologist of Kerala, providing us with a platform to speak, learn, teach, and grow. So today's session is mainly focusing on one second. So today's session is mainly focusing on the FAICO exams. FAICO exams, as we all know, it is not a recent one. It has been there previously also, but very few of us have taken this exam. That's what I came to understand recently. So today we'll be having the subspecialty of retina. This is first in the series of a webinars that will go on to cover the other subspecialties as well. Today's session we'll be having one speaker who will be talking to us regarding the theory preparation, how to prepare for the theory, and the second speaker will speak to us on how to prepare for the practical part. Is my slide visible, sir?
Yes. Yes.
So first one is on this. So along with that, we have a session of, we have a panel experts who have already taken this exam previously, and they also will be sharing with us their expertise and their insights regarding these exams. This FAICO exams, as we know, it was first established in the year of 2010 by AOS, and the main goal was to update the knowledge, improve the clinical practice patterns, and to establish a uniform fellowship system across India. These exams have recently grown popularity, and more ophthalmologists have started taking these exams. So we felt this webinar is a need of our, especially for those who are planning to take these exams but have no idea what to study and what to expect when you go for practical exams. So unlike many other international exams like FAICO, FRCS, which actually comes with a very hefty price tag, this FAICO exam usually has a very affordable minimal fees of nearly 10,000 rupees only, and it is held easily at accessible centers throughout the country. So it is actually easy for us to appear for this exam and to pass also if we know the right thing, what to study and how to prepare for the practicals. So we believe that regardless of the age and experience, appearing for this exam is going to be a great way to update your knowledge and to strengthen your resume. So let's get started. So I'll just begin by introducing our speakers. And the panelists, first I'll introduce the panelists. So in the panelists, we have Dr. Rahul R. Menon, Dr. Indu J. Nair, and Dr. Divya M. Nair. Firstly, Dr. Divya M. Nair, she is a consultant vitreoretinal surgeon at Abate Eye Hospital, Calicut, Kerala. She has completed her 2-year surgical retina fellowship as well as a 6-month medical retina fellowship from Comtrust Eye Hospital, Calicut, and she has cleared her FAICO in 2017. Next, we have Dr. Indu J. Nair. She is a VR consultant at Chaitanya Eye Hospital, Trivandrum, and she has done her DNB from Aravind Eye Hospital, Tirunelveli, and fellowship in VR surgery. She has also cleared FICO, MRCS, and FAICO in the year recently, 2024. Her areas of interest is in diabetic eye disease, AMD, and clinical research and macular disorders. Welcome you, ma'am. And then we have Dr. Rahul R. Menon, who has done his fellowship in VR from Shankar Nethralaya, Chennai, and has cleared FAICO in the year 2018, MRCS Glasgow also. And he is a recipient of the prestigious Ratan Tata Fellowship from Shankar Nethralaya, Chennai in the year 2016. So his expertise is in the field of diabetic and macular surgery. So heartfelt thanks to each one of you for saying yes to join us today as a panelist. Now let's go on to the speakers. We have Dr. Anjana, who will be dealing with the theory part. She's a consultant in VR at VR surgery at Comtrust Eye Hospital, Calicut. She has done her MS ophthalmology from MAS Medical College, cleared her DNB from NB board exams. She has got a fellowship in VR surgery from Comtrust Eye Hospital, Calicut. And she is a recipient of KSOS COC PG Gold Medal in the year 2016. And she is also a winner of Retina case presentation at YOC at the annual conference held in the year 2023. She cleared the FAICO very recently in the year 2025. And the practical part of this FAICO Retina series will be dealt by Dr. Ashapurna Borgoin. She has done her Vitretina Fellowship from Giridhar Eye Institute, and she has cleared her FAICO last year. She is currently a consultant at Chaitanya Eye Hospital, Palarivattam, Kochi. So that's all. Without much ado, let's move on to the speakers. First, Dr. Anjana will be talking to us regarding the theory preparation, and after her, we'll have the insights from the panelist. Over to you, Dr. Anjana.
Thank you. A very good evening to all. Thanking KSOS and LOSI for giving me this opportunity, and also thanking all my dear teachers and colleagues. Now I shall share my screen. Is it visible? Now about getting ready for FAICO Retina and Vitreous Part 1. Now what is FAICO and why FAICO? FAICO is Fellow of All India Collegium of Ophthalmology. It is an award granted by the All India Ophthalmic Society. And hence it can be considered as a standardized fellowship exit examination. Now, clearing this exam is really a feel-good thing. In fact, it is an opportunity to be recognized as a super specialist. And of course, the learning process still continues, especially in the field of surgical retina. Now, the subspecialty awards are given in the following category: cornea, comprehensive ophthalmology, cataract phaco, glaucoma, oculoplasty surgery, pediatric ophthalmology and strabismus, refractive surgery, retina and vitreous, and UVI. Now, coming to the eligibility criteria, in order to apply, a person must be an IOS member who has completed post-graduation in ophthalmology, DO, DNP, or MS, with a minimum 2 years experience after completing post-graduation. It could be either a completed subspecialty fellowship or at least 18 months of the fellowship, or a senior residency or at least 18 months of senior residency. A person who is having at least 3 years of practical work experience in the subspecialty is also eligible for applying. The cutoff for the following criteria is September 30th of every year. Now about the examination centers. The examination centers are for stage 1 is New Delhi, Mumbai, Kolkata, Hyderabad, Bangalore, and Chennai. Now the application form is given in the IOS website, and the fee for the exam is rupees 10,000. Now, the exam is conducted in three-stage process. The first is an online MCQ exam. And after clearing this exam, we can go for the next part, that is the OSCE and the Viva Voce, which will be held on the same day. Now, coming to stage 1, that is the first part, that is the online MCQ exam, total of 2 hours with 100 questions, and the pass percentages, the marks required to clear is 70%, and there is no negative mark. Now, coming to the preparation aspect, compared to the practical and Viva Voce, the theory examination requires a little more of preparation because more of theoretical things are asked, which we often tend to forget easily. So we have to go through this in detail before the exam. The curriculum for each subspecialty is clearly mentioned in the AOS FAICO curriculum book. A quick way to start with would be brushing through the Kansky book, which everyone would have read very well during the PG time. Then the Ryan's Retina, this is considered as the Bible in Retina. This is an extremely useful book. All chapters have been laid down beautifully, and in-depth knowledge can be gained by reading this book. If you have just started your fellowship, try to read as much of this book as possible. Then similar is the case with the BCSC course Retina and Vitreous by the American Academy of Ophthalmology. Then coming to some MCQ books, Review Manual of Ophthalmology by the Massachusetts Eye and Ear Infirmary is also a very nice book. Here, chapter-wise, each subspecialty MCQs have been given. Then also this Review Questions in Ophthalmology is again another wonderful book where MCQs have been laid down in a similar pattern. Then there is a full MCQ book. This is actually a combination of MCQs collected from a large number of books. This has MCQs from the Massachusetts book, that is the first book, the third as well as the fourth edition. Then the Review Questions in Ophthalmology book, the third edition MCQ, this book is having, along with the American Academy of Ophthalmology MCQs and Kenneth C. Chern Friedman book MCQs. I forgot to mention the book that I showed here. This book also has MCQs in the end. Those MCQs are very useful. And first try to solve those MCQs and then go to the discussion part. Next, there is an online platform that is there's a one network by the AAO, American Academy of Ophthalmology. And if you are an AIOS member, you can get access to this. And by logging in, after creating an ID, you will get access to all the AAO MCQs. Then Chua's Ophthalmology website is another useful website. Here also we have MCQ set as subspecialty wise. Then there is iFocus Online. This is a YouTube channel where experts across India have made talks on almost all important questions in ophthalmology. All important topics in ophthalmology. Now, as per the exam that I had written last year and as per the questions recorded by previous candidates and as per the general pattern of how and from where more questions are asked in Retina and Vitreous MCQs, I have found the following topics to be must read, apart from the routine medical and surgical case scenarios. And in that, starting with basic sciences, the embryology is very important. The stages of retina and vitreous development, then primary, secondary, tertiary vitreous, then anatomy and physiology must be very thorough. Then retinal imaging and diagnostics is another very important topic from exam point of view, that is FFA and ICG. They ask regarding the concentration of dyes, then about the stages and at what second each stage starts, such minute details. Then in OCT also about the generations of OCT, the wavelength used, then the resolution in micrometer, then FAF is important. Then electrophysiological tests you have to be thorough with ERG, all aspects, EOG, VEP, then ultrasound B scan, then color vision and contrast sensitivity testing. Next, retinal degenerations and dystrophies. We don't come across much cases in our day-to-day practice, but this is very important from the exam point of view. That is RP and allied disorders, hereditary vitreoretinal degenerations, macular dystrophies, hereditary choroidal dystrophies, abnormalities of rod and cone function are all very important from exam point of view. Then coming to other important topics, that is diabetic retinopathy in and out, the age-related macular degeneration in and out, and retinopathy of prematurity in and out. Also, the studies and trials related to these three topics are very important. Then endophthalmitis, retinoblastoma, and choroidal melanomas, other areas of frequently repeated questions. Then optic pit maculopathy and drug toxicity of the posterior segment. Then retinal lasers also similarly, the mechanism of action, then the wavelength and the other laser parameters, the lenses. Then PDT. In PDT, actually, I had skipped this topic for last time because the dye is not available in most areas, but we had a question last time regarding it was a combination question, the dose plus the exposure time and the energy they had given in a confusing manner. So all those minute details, the numericals and all, we have to be thorough with. Then intravitreal injections again, all the anti-VEGF agents, the trials related. We had a question on faricimab drug trials last time. Then all the anti-infective agents, then the steroid preparations, the dose frequency, everything is very important. Then in surgical retina, buccal was a favorite area of interest. The scleral buccals, physics, the dimension of the buccal, that is important. Then the shape of buccal and all those fine details. Then surgical instruments, dyes in VR surgery, then vitreous substitutes, the physical properties, macular hole indices. Then finally, all the recent advances in both medical as well as surgical retina are must read. Then take home is practice as many MCQ questions as possible. Then plan wisely and well in advance before giving the examination. Thank you so much and happy learning to all. Thank you.
Thank you, Anjana. Thank you, Anjana, for that elaborate discussion on theory preparation. So first, now I would like to go to the panelists. First, we have Dr. Indu Madam. Indu Madam, can you please share your preparation, how you prepared for the theory exam? Indu Madam, are you there? I think she's not live. Dr. Divya. Dr.
Yes,
Divya. Yeah. Indu Madam, please share your preparation, how you prepared for the theory exam.
Okay. Theory, I first is Kansky that retina chapters, retina vitreous, and all those chapters. So the Kansky is very important for your basic preparation. And then I have read the AAO series, the BCSE series, which Dr. Anjana has mentioned. And in that, the AAO One Network MCQs are very important. I think we got like 2 or 3 questions directly from the AAO MCQ itself. So AAO One Network MCQs, you should go through it. And they keep on revising it, One Network questions. So as much as possible, if you can access the previous questions also, you can go through it. And so these 2 are very important. And other than that, the books which you have mentioned, if you can go through it, that is very good. And one important thing is they have given like lot of importance to the recent advances, recent clinical trials, like for faricimab and tolisumab, and also the genetics part. Now more and more gene therapy and everything is coming. There are questions on Luxturna, which is on reverse congenital amaurosis. And also there were questions on optogenetics, the genetics part of it, and also the recent medications for geographic atrophy, like pegcetacoplan, like all the complement pathway. So all the recent things, anything newer FDA approved drugs, like now recently there is for Mactel. So all those recent things you should go. They will definitely ask 1 or 2 test questions from that. Then other than that, like very minute details of this buckling elements, whether it's symmetric, asymmetric, concave, convex, unless you read through it thoroughly, you won't be able to answer, because the sub-questions they ask is very fine, like very fine details they ask. And also recent biomarkers, like anything new in the recent any articles, if you have got time finishing the basics, try to go through the recent articles, especially trials like drcr.net trials for DME, all those things. So when they ask, unless you read it, you will get confused when you read the choices. So those things you should go through. Other than that, I think she has covered. And ROP is a very high yielding topic. You will definitely get questions from ROP, especially the recent ICROP 3, guidelines, their classification. So genetics. So I think rest everything Anjana has covered.
Thank you, madam. So to recapitulate what Dr. Indu has said, we have to be thorough with the recent updates, recent trials, and also genetics, and also the MCQ questions from AO network is very important and it is high yielding. So other than that, Dr. Rahul sir, do you have anything to add on theory preparation or any other something different from how you prepared?
I think Dr. Anjana has covered most of the things that we are supposed to cover. So during my preparation, I was just fresh out of fellowship. So I had brushed through Kansky, and I had read a lot of Ryan's during my fellowship. So I did go through some of the topics like that, or, whichever I felt I had needed to pay more attention. So it's something like you should gauge where you are actually, what are your shortcomings. So electrophysiology is something which we tend to kind of ignore a bit, right? So I went through most of this electrophysiology study. So wherever I felt that my shortcomings were there, I did go through that. But besides that, I did not specifically study for any MCQs. And yes, besides this, I also went through a lot of studies, recent studies, articles, because that was what had spoken to a few of my seniors who had given the exam previously. And what I got to know that they were very much interested in because protocol when I had given the exam, the protocols DRCR protocol T studies second year report had come up. So that was like kind of hot topic for them. So I think now that is an old topic. So whoever are giving the exam now, I would definitely recommend them that be up to date with the recent trials and studies, and go brush through Kansky, and wherever you feel that you need to know a little more of the topic, probably go into depth in that. That should be enough. And yes, going through practicals is always a plus point.
Okay. Thank you. Dr. Divya ma'am, anything you would like to add on the theory part of the exam?
What I would like to add is my little concern when I was giving the exam was whether we will get UVA questions also. Because as retinal people, we are dealing with a lot of UVA also. So from my exam, I understood that posterior uveitis, whichever affects the retina, those questions will be asked. So you have to prepare on a little bit of UVA also. So UVA related questions are there, surgical retina is there. The thing is, this theory exam, you have to really study in depth. The practical is not that difficult for somebody who is doing a retina fellowship, but the theory part, you have to be really very well versed. Like the studies, they are asking minute small details from the studies, like what was the end point of the study or how many months, and all the small details where you may not just read the study in a GIF and go, but you cannot go like that for this exam. This exam, 70% marks are required to clear, and some of the MCQs can be really confusing. So UVA, ERG, and all those things which we might ignore, genetics, that also, and the latest things, as other people have said. That is the point I wanted to add. Yeah.
Okay. So there is a query that has come in the YouTube is that they have still a doubt regarding the eligibility criteria. I think there are 3 separate eligibility criteria, right, Dr. Anjana?
Yes, yeah.
Please recap that slide or that again.
Actually, a person who has what is required is minimum 2 years experience after completing post-graduation. So it could either be 2 years of completed fellowship or 1.5 months of fellowship. So if you're doing a 2 years of VR surgery fellowship, after 1.5 years, you're eligible for applying. And also, suppose a person, similar is the case with senior residency. In some institutes, they give senior residency. So senior residence also, if you have completed senior residency in a particular subspecialty or ongoing subspecialty training as a senior resident, if you have completed 1.5 years, you are eligible. And also, if a person is having only practical experience in a subspecialty, that itself is more than enough. There is no need of a fellowship as such. If he's working in an institute and if he is working in retina and vitreous department and he or she is having 3 years of practical experience, still that person is eligible to apply.
Okay.
Is there anything?
Yeah. So just to recapitalize, either that person after finishing his or her post-graduation should be working in a retina department for 3 years, or he should be doing a fellowship in VR itself, and if he should have covered almost 1.5 months of it, or
And years.
that person should be a senior resident in retina department and have completed 1.5 years as a senior resident. Should be
Yeah.
1.5 years, no, not
Yeah,
just
1.5 is required.
Okay, so that is the eligibility criteria to write the FAICO retina exam. Any more questions from the panelist to Dr. Anjana? I think there is nothing. So now let's go on to Dr. Ashapurna. Dr. Ashapurna will be covering on how to prepare for the practical exam part of retina exams. Over to you, Dr. Ashapurna.
Are my slides visible?
Yes, please go on to the full screen mode.
Good evening, everyone. At the outset, I would like to thank KSOS and YOSI for making me a part of this invaluable talk. And Dr. Anjana has already in details discussed about the theory part, and I'll be dealing with the practicals. So this is my timeline of my exam history. So I had appeared for MS, and following that, I had appeared different exams. And from this, I want to point out that when you are giving an FAICO exam, you have already given at least one or more than that. So it's the FAICO is also a like a simulacrum of this exams. So the practicals is mostly the same. The OSCE, it will contain OSCE and it will contain Viva voice, except that it won't have real patients. I had given my FAICO exams by the end of my fellowship. It was in January 2024. So I felt that by the end of your fellowship, if you give your exam, you are like fresh from fellowship. So the basics already you know. So I feel that is the right time to give. But any time in your life you want to give, it's a good decision. So why did I take the exam? Firstly, it was to test myself after the fellowship, and then it is an exam which is accredited by the highest authority in ophthalmology in India. So after giving the exam, you get a boost or confidence to practice this subspecialty in your practical life. So coming to the exam pattern, it will contain OSCE and Viva voce. So Viva voce will have a medical retina station and a surgical retina station. OSCE will have around 100 marks, and there will be 10 OSCE stations, and the 10 people will be called inside, and you'll have to move around 10 OSCE stations. And the questions will be displayed in the desktop, and each station will have around 2 to 3 sub questions. And you really need to be objective. Just you need not put any details, and just put as point wise. And every station will have 5 minutes. I think it's a good enough time to attempt all the questions. If you miss, or suppose you are not confident or you are not sure about the answers, you can go to the next station, and if when you get time, you can fill in the remaining answers in the last station. So the topics can vary, like it can vary, it can be anything, but most commonly asked, which I had encountered, were mostly on imaging. It can be FFA, ICZ, Octa, FAF, OCT, anything, electrophysiology, procedures which you commonly perform, or it can be any clinical scenarios or recent advances like Dr. Indu had already told pegcetacoplan, newer anti-VEGFs, and the studies relating to it. And they might give you instruments, and they will ask you where these instruments are used, the surgical techniques along with that. I'll give you certain sample questions for OSCE. Like this is just examples. You might not get the similar cases. So in this, we can see 3 pictures. So they will ask you the first picture, what is this? This is an FFA finding, and what is the sign? So you know that it's a smokestack sign. And so you know that it is CSR. So in the next question, they will ask you in the ICZ, what finding do you find? It's a Pecci vessel which you see there. Similarly, in the OCT, you see a vacuole sign. Then they might ask you about ERGs. Like these are the questions which I had faced. So in this question, there is a fundus picture which looks almost normal, and then you go to the ERG. In the ERG, there is slight changes in the B wave. So it's a negative B wave, and it's a negative ERG. So you know that a negative ERG with a normal fundus photo, a normal fundus picture is most likely congenital stationary night blindness. So in the third question, they might ask you like different diseases, where do you see this? You just need to put 3 points, like 3 diseases like that. You need not elaborate it. So another question which was asked for me, it was a picture of subhilar hemorrhage was shown, valsalva retinopathy, and they had asked how to manage this condition. You can write 2 points, like 1 point you can observe, or the second point, you can write, you can use YAG hyalodotomy. So the parameters of these procedures. So already you know the things, but certain things like the parameters, if you're not using it that often in your OPD practice, you might forget. So you need to revise all these parameters and numericals. So in medical retina, they will give you case scenarios. There will be no patients, but they will give you a short history from this picture, or the imaging will be presented on a screen. And they'll ask what is the diagnosis, and they will see how you approach the case. What will be your differential diagnosis, and how will you go to the management of the case. In my case, I had got a picture showing one eye of B scan, and the other eye showing PDR post PRP. So in the B scan, it looked like a VH. So I said it's a VH most likely due to PDR. And they asked regarding the management following that. Will you go for anti-VEGF, or will you go for vitrectomy, like that? So another case was on acute retinal necrosis. They put a optos picture with all extensive peripheral retinitis and lot of hemorrhages and all. So from that, they will ask you, they will go to the management of acute retinal necrosis. And some of my friends had got CMV retinitis, choroidal melanoma, also retinoblastoma. So I would like to highlight one point here. Like when we are preparing for retina, we totally tend to ignore uvea. But some amount of uvea you need to prepare, like at least the pan-uveitic entities like VKH or acute retinal necrosis, POR, and CMV retinitis. So because there is some overlap in these cases. Then coming to surgical retina, in surgical retina, mostly they ask the basics of vitrectomy. Like they told me, start from putting the trocars. So after putting the trocars, how will you ensure that the infusion cannula is inside? And then after that, if there are any during the surgery you notice that the infusion cannula is not inside, what will you do? If it is subretinal, what will you do? How will you manage? Those kind of questions, or like how do you induce a PVD, and how do you make sure that the PVD is induced? What's the role of IVTA? Those kind of basic questions they ask. They want to know like whether after passing out you'll be able to practice the basic things. So they can ask about different tamponades, silicone oil, the gases, PFCL, what are the advantages of each over the other, and the different cutters, about vitrectomy fluidics, the duty cycle of different cutters, and about scleral buckling. The scleral buckling you should know because they will be asking you about different sizes of scleral buckle, and like what is the advantage of scleral buckle, in which kind of retinal detachment will you use, will you prefer scleral buckle. Then macular hole surgeries, like dye used, brilliant blue dye, what are the side effects, are there any side effects, what are the advantages of brilliant blue over the other dyes. And another important thing is endophthalmitis. As all of you will be managing endophthalmitis during your fellowship, but just before your exams, you should revise the intraocular antibiotics, their concentrations, because these are very important, and you can't miss it. You can't make a mistake while telling the doses. They can also ask you about how to differentiate an endophthalmitis from TAS and the studies related to it. And further, they can also ask about intraocular foreign body removals, the magnets, and the different instruments used for it, and some amount of diabetic vitrectomy. They will ask you about the truncation, delamination, different methods used for diabetic vitrectomies. Otherwise, they can ask you anything, but these are the most commonly asked and the basic things which you practice during your fellowship. You will be already knowing this in depth. So I appeared for my theory in December 2023 and I gave my exam in Hyderabad. So you can choose the theory centers but you can't choose the practical centers. So after giving my theory, within 1 week or 10 days, I got a mail that I have cleared the theory exams. And then they told that you will be notified about the practical exams. And that time is really short. So after this mail, the practical exam was within 2 weeks, most likely. And that means you will not get that much time to prepare for practicals. So during your theory exams, think that you will pass the theory and start preparing for your practicals too. Little bit about the day of exam. So it was my center was in Sankar Nethralaya. So mostly the centers will be either in AIMS or Sankar Nethralaya. So it is held over 1 or 2 days and they will be allotting slots for you, either the morning slot or the afternoon slot. Try to reach early, try to reach 1 hour ahead of time. And the things which you need to carry is an apron, which is a must, then admit card which you'll be provided, and other than that you can carry your pen, watch, and your phone and bag and all other things will be kept safely in the safe areas. So as Dr. Anjana had already told, preparation, it's mostly when you are preparing for theory, you are also preparing for practicals. Like when you are revising for theory, like you'll be reading this MCQs like Massachusetts or Churn and other MCQs like AO, Retina and all. So what I would suggest is for practicals, well, try doing this MCQs, and when you do the MCQs, read the answers. And like when you feel that you have forgotten something, you can go back to the text. Like during my fellowship, I was using this text from Dr. Atul Kumar. I was also reading Ryan's Retina, but it was because this contained all the important things in a precise manner. It is useful and it helps quick revision. So you can prepare like that. But mostly for practicals, they will ask you the basics, which you have already learned during fellowship, which you have already managed, the case scenarios which you have already managed. For instruments and all, you can go through eOptha VR instruments, or you can go to your OT and ask if there is a separate book for instruments. And otherwise, for OSCE, you can go to iFocus videos, which will deal in depth about OSCEs in Retina. So my last words: be positive and calm. Believe in yourself because you already know all the things, all the scenarios you have gone through during your fellowship, and you have already managed these cases. And any time before exam, it's never late to start preparing. So whenever, don't think that you are not well prepared, because you will never be fully prepared. So whenever you get a chance, start reading, or like in the last few days, if you get time, you can flip through the pictures or figures in Skansky or Atul Kumar and read the notes or captions along with that. So thank you. Go with a positive attitude and think you never lose. Either you win or you will learn. Thank you.
Thank you, Dr. Ashapurna. It was a wonderful presentation. So I would like to stress on the words that Dr. Ashapurna had said last. It is never late for the exam because nobody will be prepared completely. You can also prepare as much as you can. So now let's move on to the panelist. Dr. Divya ma'am, can you recall any questions that were given to you during your practical exam? And how was your experience at that time?
Yeah, the practical was compared to the theory much better. That's the first thing I want to stress, because practical is something we are doing every day in our fellowship. So that way, during the exam, it was very nice because we have already given this OSCE type of exams before also for other exams. So it is a little above your PG exam. into the Retina Fellowship exam. There was, I think, FFA of FEVR, if I remember, and they had asked 2-3 points, how will you manage, in what are the stages of FEVR, simple questions like that. There was an Octa of, I think, Mactel. Octa was very new at that time when I was giving the exam. So Octa of Mactel, and in the, I think the Viva voice, Dr. Atul Kumar was my examiner at RP Center. He asked me what are the stages of this thing, Mactel in on OCT. So it was easy. It was not like, to tell about some studies or something. This was very, very practical and what we are knowing at that point. Then I think there is an instrument which I had was the chandelier for vitrectomy. So 2-3 questions about that. I didn't find it to this practical exam to be very demanding. Overall, it was a good experience. The 2-3 challenges which we can expect is this, as Dr. Asha Purna mentioned, the date will be like within 2 weeks, and you have to arrange for your transport, travel, you have to manage your family back home, you're in between a fellowship. The 2-3 things you have to be mentally prepared before the practical. Those are the practical points. Otherwise, Dr. Asha Purna has really elaborated very well. I remember very few things from my exam.
Thank you. Thanks a lot. So over to Dr. Rahul sir. Which was your center and what was your experience?
Yeah, so my center was in AIMS, Delhi, practical. So the thing to stress about is for theory, yes, you have to slog a bit and read it a bit. But for the practical part, what happens is the like Dr. Divya just said, the preparation for it work happens during your whenever you are in the OPD, in the OOT, or during your fellowship time. So they do gauge. Most of the senior professors usually take the exam, so they do gauge you whether you are into a surgical background or medical background. So people even who are giving the medical retina, who have done medical retina fellowship and don't have much into exposure to surgical this area, they will get to know that you have more into medical, so they will definitely try to target their questions into medical part. So that is one of the things. So medical retina did not people did not slog too much about the surgical instruments and everything, because I still remember one of my colleagues who had done a medical retina fellowship during at SN. She was also there. She was asked a bit about buckle, and after the exam, she asked me like she was asked just one question, and but then they got to know that she's not from a surgical background. So they all the questions were directed towards medical retina, and even she cleared the exam along with me. So the questions that I was asked, I don't remember much about the OSCE. I think there was one about an extinguished ERG. And one thing I will definitely like to stress about is believe in yourself. So you have done your fellowship, you have slogged day and night for a couple of years, and you have done in your practice. So that is going to help you out, because I specifically remember there was this question that was asked to me by Dr. Atul. He showed me a picture of an ROP. It was not a full wide field photo, maybe 50 degrees. And he asked me what was that. So that had a plus disease. There was a zone 1 ROP. And even a couple of my seniors who had given the exam, and like, we usually do that once the people who give up the exam and they come out, we'll start bothering them, like, like buzzing bees, like, what question were you asked? So everybody was telling me that it was zone 1 APROP kind of picture. But when I saw the picture, what kind of stood out for me was the macular area was completely in focus, whereas the nasal area to the disc was not it was completely out of focus. So when he asked me what it was, comment on the picture, I said, sir, this is a ROP, this is a plus disease. I told the findings that the engorged vessels, there's an avascular retina that can be seen outside the macula, and it's a mostly APROP picture, but I would like to see this patient. And he asked me, would you like to see the patient? I said, like, sir, I can see that the nasal area is out of focus. Now it could be a artifact or probably a detached retina. So he said, like, why would you like to know that? So I said, like, sir, if it is a detached retina, it is a stage 4I, because macula is attached, so stage 4A ROP. So the treatment is going to be surgical rather than medical. And that's it. That he didn't ask me any question after that. And post exam, during our a cup of tea, that I got to know that that picture was taken from Professor Atul's book itself, and it was a stage 4A ROP. So believe in yourself and back yourself. So that was one question that was asked to me. The second question was that I was shown an OCT of a diabetic macular edema patient, like it's a CME, basic, not diabetic macular edema, CME. And I was asked what could be the what was the management for this patient, and the patient had a thick hyaloid, There was a lot of hard X-rays in the macula, and there was a lot of ellipsoid loss. So he did ask me like, how would you like to manage this patient? And I had told that probably I'll start with anti-VEGF, and if it doesn't work well, I might shift to dexamethasone implant. And he did ask me about the visual prognosis in such cases. So considering that the ellipsoid loss was there, so the patient would have a poor prognosis. So they asked more practical questions. Surgical instruments, if I remember correctly, I was asked what buckle, and I think max grip or end gripping forceps was asked. I was asked to identify that, and I can't recollect most of the theory questions, practical questions now. But what I feel is they will definitely probe you and they'll gauge you whether you are from a surgical or a medical branch, and then medical expertise, and then they'll direct the question in that direction area.
Thank you. So, over to Dr. Indu, ma'am. You have recently cleared the exam. So, can you recall the questions from your practical exam part?
Yes, practical, as everybody has said, I think practical is a little bit easier compared to the theory part. So they will ask basic questions only. It's like how you are doing your OPs, just like that. And for the surgical, regarding the OSCE part, this year I had an SN, Shankar Netralaya, and we were made to sit in an auditorium, and the questions were projected on the screen. So we were, after 5 minutes, they were changing. Like we didn't have to go from one station to other. It was like that. And in the OSCE part, they even showed the B-scan videos. Different. They showed 4 different. Like one was asteroid hyalosis, one was PVD, one was probably vitritis, one was RV. So how will you differentiate like that? So some questions, the explanation part you have to write a bit more. So make sure you're writing fast. Some questions 5 minutes is enough. Some questions it is not enough. So write it fast. And they have like equal weightage for medical and surgical part in OSCE. They had many questions regarding surgical also, and equally medical. We had a question of multifocal CSR, and ROP was there. Diabetic vitrectomy was there. One eye SNPDR or early PDR. Other eye was advanced diabetic eye disease. How will you manage each eye like that? So that was the OSCE part. And then the Viva part, there were between 2 stations. Each station had 2 examiners. And the surgical part was, I had like 3-4 questions they projected in the computer. ERM, epiretinal membrane, they were asking steps of surgery. They were asking about dye and everything. And then there was one was macular hole. They asked about the healing techniques. It is like how we can answer everything. It is not like they will ask many like very difficult things. And one was a dense premacular hemorrhage case. How will you go about with this case? And another one was a open globe injury, and they showed a B-scan along with it. It was an endophthalmitis. So they asked, how will you proceed with this case? So securing the ocular surface is most important. So you should tell that maintaining the globe integrity, suturing the corneal posterior wound is important first, and then we will go about with the posterior segment management. So that was regarding the surgical part, and the other station they had instruments along with the medical part. So instruments, they had everything they had. They even had the ERG electrodes, Durian and different types of electrodes. They had even ROP speculum, and they had all the vitrectomy instruments. They will ask us to identify, and they will ask us to pick which one you want. You can pick, and then they will ask questions about it. So whichever you are more comfortable with, you can pick it. It was like that in our exam. And then the medical part, I was asked like regarding the SS Opta and SD Opta, the lateral, the very fine details they were asking, how many scans, what is the lateral resolution, axial resolution, all those things. And basically, I had questions on ocular oncology, which I was not expecting. There was choroidal melanoma, B-scan was there, and they were asking the B-scan features and how will we differentiate between various ocular tumors like hemangioma, melanoma, management part regarding acute retinal necrosis. There were questions, and then the basic AMD, macular degeneration, and diabetic retinopathy. So I feel overall, compared to the theory, practical, it is your basic knowledge. And of course, when you read for the theory, you will be going this is like a preparation for practical also. So just go confidently. That the thing is there, that Viva, that little bit of anxiety will be there, but I think practical is easier compared to the theory part for an FIC.
Thank you. And my sincere thanks to all the panelists for trying to recall your exam questions and to share this here in this platform. So we have few questions from the audience. First question is like to Dr. Ashapurna. Are we allowed to carry our own instruments like 90D and 20D lenses, etc.?
Yeah, you can carry, but it's not required because there won't be any patients because only case scenarios will be showed or like you'll be asked in a screen. So I don't think it's that necessary. But I had carried, and many people with me they did not carry, and some people were panicking like should we have carried some this lenses and all. Even the colors and all, like for drawing the EMSLA chart and all, many people had carried, but it was not asked for. It was not required.
Okay. Another question that we have in from the audience is medical retina people allowed to take the exam? I think they are also allowed to take the same exam,
Yeah,
right?
yeah. With us, one medical retina doctor was there, but I didn't finally, by the end of the exam, I didn't ask her like what were the questions asked to her. But she was there. I think she had passed also.
And UVA people?
UV, I'm not sure actually.
And another question that we're having is some places medical retina is for 6 months and some places it is for 1 year. So will that clear the eligibility criteria?
I don't think so. After your medical retina fellowship, you have to again be a senior resident in that place, maybe for 8 more months or like 1 year. Only
Or
then you'll be eligible.
maybe after working for 1 more year, they'll be eligible,
Yeah,
right?
yeah.
Okay. So these are the questions that we are having from the audience. So any more questions that we have to Dr. Ashapurna? Dr. Divya, madam, any questions do you have?
No, I think everything she has answered very well. She has elaborated on in her talk so many questions. One thing I would like to point out is maybe from 2017 to now, the practical also is becoming more structured. At that point, it was just like a PG Viva. Now, from what I have understood from Dr. Indu, that it has become more elaborate and more questions and more instruments and everything are being asked. At RP Center, it was more like a PG exam, a little more advanced than a PG exam. Now it is more advanced. So better to ask from the latest people who have gone for the exam.
So any more comments from the panelist or from the speakers here? Dr. Rahul sir, Indu madam.
I think it's both Dr. Anjana and Dr. Asha have both covered the topic very well, and like Dr. Divya just mentioned, it would be worthwhile to actually ask. From what when I realized this, like the pattern for the exam have changed pretty much over the span of few years. So it's always it will worthwhile to ask people who actually cleared the exam recently to get a gauge of what really is happening now.
So do you have any knowledge about the UVA and medical retina fellowship and?
I think they have a different.
Yeah, they have a separate FICO. Sorry.
There is a separate FICO for UVA, as I remember. Yes.
So I think the questions are over. There are no more questions from the audiences. So with this, I think we have come to the conclusion of today's session. We are actually very much excited to announce our plans for the second series of these FAICO exams, which will delve into each of the specialty. And second, our next specialty will be on cataract. And similar to this, there will be one speaker speaking on the theory preparation, another speaker on the practicals, and a mix of panelists who will share their expert insights about these exams. So I would like to share my heartfelt thanks to the speakers as well as for the panelists for their dedication in crafting this informative presentation. Both the presentations were excellent and they were elaborate, and to the panelists for sharing their insights and trying to recall all the questions from their time and to share their expertise with us. So special appreciation going to the speakers. And now, before we close, I would like to extend my sincere gratitude to all the KSOS office bearers for this steadfast support, and special acknowledgement to Boston sir for his pivotal role in guiding us with the topics and for diligently organizing these events. So lastly, but not the least, thanking our audiences who have shared, who have spent their like precious time of the evening with us. And I think we hope we have met your expectations. And I think this session was really useful for those who are planning or who are already applied for this FAICO exam. And have a pleasant evening. And once again, thank you everyone. Thank you audiences, and thank you all the panelists and speakers for being with us. We have finished on time. Thank you. Good night.
Thank you. Good
Thank
night.
you.
Thank you. Good night.
Bye.
Thank you.